Good morning, everyone. This is Dr. Erica Liu from IQ Laser Vision presenting our very first live webinar on surgical myopic treatments. Thank you all so much for being here. I'm trying to keep this a bit more interactive, so you should be able to put questions in on the side so we can pause and address any questions that pop up. I'm sure that some questions that pop up will be helpful for everyone. So feel free to put those in as we go along. A little bit about myself before we get started. Also about the presentation. So mostly we'll be talking about surgical myopic treatments. We'll be glossing over a lot of the things that you're probably already familiar with and then spending a decent amount of time on SMILE. And then of course, if you have more questions on the things we're glossing over, I'm happy to answer those during the presentation if it's easy. Otherwise, of course, after the presentation, you can contact Nick or our center and I can reach out to you individually. So about myself, I have been working at IQ Laser Vision for over a year now. I grew up in the Bay Area. My first job out of college was actually at Google for email marketing. And then right as soon as I saved up enough money, I ended up getting PRK. Paid $6,000 for it. This was 12 years ago. And I had to get PRK because of my high prescription. It ended up being really the best decision and investment that I've ever made and really allowed me to focus on my medical training and patients because I was worried about getting up in the middle of the night, fumbling with my contacts, or being in a dirty emergency room with foreign bodies in my eye. I didn't have to worry about falling asleep when I was post-call or anything like that with contacts in my eyes. So my training has been mostly done in the UC system. I did go throughout the country to other eye centers that were great experiences. I've been in Utah, I've been in Boston, Albuquerque, and also in China. I've had refractive training at the Navy Refractive Center and the Shiley Eye Institute. And the more I learn about it, the more I'm excited to kind of spread the news about everything, even to my fellow ophthalmologists who we don't even really get much training on these things ourselves during residency or fellowship. So without further ado, I'll continue here. So Dr. Lin is the CEO of our company, and also I have received financial support from Zeiss in the past, just as a disclosure. So the common surgical myopic treatments that you guys are all probably familiar with, we'll be going over those in bold. LASIK, cataracts, premium IOLs, refractive lens exchange, Vision ICL, the implantable collamer lens, and RealX SMILE. And the ones that you're probably familiar with and that are not very common anymore is PRK LASEK, which is very similar to PRK, Intacs, and orthokeratology. So briefly going over PRK, LASEK, Intacs, and orthokeratology. You guys probably know more about orthokeratology than ophthalmologists do. That's just reshaping the surface of the eye with contacts. Not really surgical, but physically treating the myopia. And then for PRK, LASEK, that is actually removing the epithelium of the surface of the eye and smoothing out the surface. Not typically done anymore unless there's special cases because the recovery time is long. And even though the results are very good, such as my own when I had PRK 12 years ago, you can kind of be put out of work for a week, if not longer than that. Intacs as well is typically just used for keratoconus, and that's inserting these plastic implants into the eye to help reduce the cone and stabilize the eye. And that's kind of fallen out of favor with the advent of cross-linking. So LASIK, I think most people, even people in the general public, are familiar with LASIK. A flap is made by a microkeratome or femtolaser. Most of the time, femtolaser. There are still special cases where we do the microkeratome, for example, scars or previous old LASIK. The flap is folded back, and the stroma is treated with the excimer laser that flattens out the surface or steepens it, depending on if they're initially myopic or hyperopic, and then the original corneal flap is repositioned. This allows for a quick healing time and minimal discomfort. So cataracts premium IOL refractive lens exchange. This alone can be an entire conference, but just to give you a quick background as well, there's lots of different options for patients who have either a little bit of cataract or if they have very high prescriptions and it's safe for them. What we can do is give one eye for distance and one eye for near, which we call blended vision or monovision, as you've probably heard, and you probably do with contact lenses as well. And those are monofocal intraocular lenses. Those are, if they do have significant cataracts, that's typically covered by insurance. Astigmatism treating lenses are actually not covered by insurance, so those do have an out-of-pocket cost. And there's accommodating or pseudo-accommodating lenses that do have extended depth of focus based on their design and their optics. There's also multifocal intraocular lenses, and as you may or may not have heard, Alcon just came out with the PanOptix, which is a trifocal lens, which is used more extensively in Canada and Europe. So we're very excited to be able to offer that to our patients, and there's been a lot of good feedback with that type of lens. And then the last one, which you've probably may or may not have heard of, which is the Symphony lens, which is an extended depth of focus intraocular lens. So which one of these lenses is good for the patient? It's important for them to have a full eye exam and have a full discussion with their surgeon or their surgeon team about what's most important to them, whether that's distance vision, near vision, independence from glasses, if they're a type A or type B personality, and their expectations for what's most important for their lifestyle, whether they need to, if they're photographers or if they do nails. So those are all things that we take into account when we decide which one's the best for them. So there is no quote unquote best lens. There's only the best lens for the individual. So next we have the Vision ICL, also known as the implantable Collamer lens, or some people know it as the implantable contact lens. State-of-the-art solution, ideal for anybody who wants reversible vision correction. It's produced by STAAR and corrects the widest range of nearsightedness, and recently approved for astigmatism as well. So here's a quick video of us implanting the Vision ICL. So an incision has already been made on the left side there. Just re-wetting the cornea. And injecting some viscoelastic. This helps the eye keep formed during the procedure. We're making the main wound here while stabilizing the eye, of course. Making sure that the surface of the cornea stays lubricated. And here is the insertion of the lens. As you can see, it's rolled up like a taco so that it can go in through that small incision. It's very thin, flexible, and just pops right in there into the anterior chamber. Putting in some more viscoelastic that gives us more room to maneuver the lens. And then we're just using a little spatula here to put the foot plates behind the iris. So tucking those distal foot plates in, and then now tucking in the proximal foot plates. Now just adjusting the lens to make sure that it's sitting centered and that all the foot plates are underneath. And the wounds we're able to seal just with a little bit of fluid. And right now we're removing the viscoelastic that we put into the eye. There's no need for sutures, and as you can see, that whole thing took about 3 minutes. So this is a schematic of where the lens sits. So in front of the natural lens, behind the iris in the sulcus, and indicated for correction of myopia up to -15 and astigmatism 2.5. And also reduction of myopia over -15 to -20. So 21 years to 45 years of age are good candidates. The advantages are exceptional vision quality, high patient satisfaction. If necessary, it can be removed, quick results within the next day, and preserves the cornea, so no corneal tissue is removed, and a proven track record, over 1 million implanted globally. So this is a chart of a patient satisfaction. So 99% of patients are satisfied, 97% would have surgery again, and their quality of vision is very high as well. And this is a image of a slit lamp where it sits. So this is the lens, and then this is the natural lens back here, and then this is the implanted lens. So many of you may have heard of cataracts being caused by ICLs, and that is something that is possible. But as you can see, very, very low percentage, on average, less than 1% of patients who have the ICL get cataracts. And most of the time, we can remove the ICL before the cataract becomes a problem. So what are the benefits for optometry? For your myopic patients, high quality vision correction for almost all levels of myopia, very, very quick results, and as you saw, very, very quick and safe procedure, and it's very, very safe as well. So for your practice, it's another thing that we have to offer to patients who previously were not candidates for vision correction surgery. Great way to treat high myopes, and of course, those high myopes are very happy and can refer more patients. And of course, these patients continue to need regular exams, so they will return to our offices because they'll still need their IOP checks, and of course to check how the ICL is doing, and because these are typically high myopes, regular dilated exams. So cutting edge care for your patients and also your reputation. So on to SMILE, so small incision lenticule extraction. So this is a different class of corneal refractive surgery. The procedure in theory is the same as PRK, LASIK, in that it changes the shape of the eye, but it does so in a pretty novel way. So first major innovation in the U.S. Laser vision correction market in 16 years. So Femto started in 2000. It's a new option for refractive surgeons for us to offer patients who are fearful of LASIK, and then those who are waiting for the next thing. Unlike PRK LASIK, this was developed in Europe, so even though it's been in the US for only 1 to 2 years, it's already proven technology. So by this time, there's been over 2.5 million procedures performed internationally and nationally. And about a year ago, it was approved for astigmatism. So almost now, at this point, most myopic patients can benefit from this procedure. So here's just a picture of the applanation cone and the patient's eye. So the femtosecond laser, it's ultra short infrared laser pulses that create some photo disruption in area like a little bubble right here. And the plasma produces a shock wave, and it doesn't injure any surrounding tissue. So what we do is we place thousands of bubbles next to each other, and you can create virtually any type of cut, very precise in the cornea without actually using any sort of cutting tools. So no sharp tools are used during SMILE. If you think about it kind of like a perforated piece of paper, you're able to open up those perforations with minimal trauma to the rest of the piece of paper. So the technical benefits. So only the VisuMax laser at this point is capable of performing SMILE. It's extremely precise. It also performs flaps as well, and very adjustable. You can change the diameter, thickness, hinge position, or the cut angle. Very, very easy docking and redocking, and very low energy. The bed itself actually moves with the patient, and it's quite comfortable for the patient as well compared to other femtosecond lasers. The reason why it's more comfortable is because it has a unique curved contact interface, so it doesn't flatten the entire eye. It's curved, and also does not require as much IOP increase as the other lasers. So as you can see in this graph, the VisuMax compared to other popular femtosecond lasers, that the pressure does not go up, so there's no blackout of the vision that patients typically experience, and very minimal subconjunctival hemorrhages, so that patients can frequently come back the next day with a white and quiet eye. The difference between a SMILE incision size versus LASIK. So LASIK, you can see here in red, it's obviously the flap that goes all the way around, usually about 20 millimeters, and SMILE is less than 4 millimeters. Step-by-step SMILE. The first thing that happens is the posterior surface of the lenticule is made. This is the refractive surface. This takes about 10 minutes. Then some side cuts are made, and then the cap is made, and the cap is 120 micrometers deep in everybody, and then there's a little incision side that allows us to access this area and remove the lenticule that's created. So this is just demonstrating this initial refractive cut. That's the posterior surface. This is the anterior surface. And then a small opening is made there, and we're able to just remove that contact lens shaped piece of tissue, and then the eye surface is reshaped to allow the light to focus in the area that it's supposed to focus in. So here's a video of an actual procedure. So the first step, we're making again that refractive cut in the back, very quick. And this is the cap cut, which is anterior to the refractive cut. And we've kind of cut to the other side where we're actually doing the manual part. We're releasing those perforations in both layers. and then removing the lenticule. So it's the same amount of time for people whether they have high prescriptions or low prescriptions. There's no smell, there's no loud noises. So the experience for patients is much better than LASIK. Although LASIK is not too bad either. So 20 minutes for LASIK, about 15 minutes for SMILE. Both of them give excellent results. So what's the recovery for SMILE? People may have heard that it's slower than LASIK, and that was the case when SMILE was first released prior to the astigmatism, and we were able to adjust our parameters afterwards. So at this point, the physical recovery for SMILE is faster than LASIK because, as you saw, the incision size was smaller. So within a day to 2 days, people can go back to all their regular activities, and the vision has been pretty equivalent to LASIK at this point. So at least in our practice, I would say 99% of people the next day can go back to all their regular activities. So the stages of recovery, immediate day 1, of course, there's still some swelling. There's a little bit of dryness sensation, foreign body sensation, night vision halos, and visual fluctuations. Over the first few weeks, there's still the visual fluctuations, night vision halos. However, what we've found is that does seem to resolve for most patients within a couple weeks. Some people take a little bit longer, of course, but the vast majority are very happy with their results the next day, and even more so the next week. If anybody does need an enhancement, we usually like to let the eye completely stabilize, so minimum 3 to 6 months. And enhancements after SMILE are extremely rare because of the precision and accuracy and also the stability that it provides. So the FDA study for our most recent parameters, you can see here that we've got SMILE, which is the sphere only versus sphere cylinder SMILE, versus the most kind of advanced LASIK, Contura, topo guided lasers that are on the market. And the blue is the SMILE, and the other lasers are the other colors. Pretty much there's been no significant difference. So the results from SMILE are equivalent to the most advanced topo guided LASIK that is out there. So basically what we have is LASIK-like outcomes with a one step. There's only one laser for SMILE, not 2 lasers, and it's also minimally invasive. Very well received by patients, 99% satisfied, 96% would have the surgery again. There's no flap, so no flap-related complications, and there's no need to move the patient from one laser to another. The way that it also, another advantage that SMILE has over LASIK is that there's less nerve damage. So here's the normal nerve plexus. For SMILE, there is still some disruption, of course, where the main incision is, but because it's deeper and because it's smaller, there's much less nerve disruption that happens with SMILE than LASIK. So the recovery from dryness happens faster than LASIK. Corneal sensation, this is a study done that brought together other studies to show the difference in corneal sensation. While LASIK and SMILE eventually become the same after 12 months, SMILE patients, the blue and the green, recover a bit faster. So SMILE is a great thing, but of course there's always, with any procedure, there's always complications. Similar to LASIK, you can have striae, you can have debris that's caught in the pocket, you can have inflammation afterwards, and ectasia anytime you alter the surface of the eye. Extremely rare for SMILE. Only a few case reports are out in the literature, and that's out of 2.5 million cases that have been done already. I assume that any ectasia is probably reported because it is so rare, so anybody that does see it will be reporting those cases. The theory is that SMILE, because it also has that smaller incision, leaves those anterior fibers that are stronger in the cornea, leaves those intact, so that could help minimize the risk of ectasia. And then infection, there's a theoretical risk. I haven't seen any cases of infection in the literature from SMILE. So backing up a little bit for the big picture, the U.S. laser vision correction market, the procedural volumes have been down from historical highs and have never recovered. So of course, in 2000, we were doing pretty good until 2008, and then the drop off probably from the economy. But now that the economy is doing pretty well, still we haven't gone back to where we want it to be. So why is that? So there's definitely still a need. And as many of you know, myopia is increasing in the US and worldwide. So there's no lack of patient need. At this point, the economy is not really affecting people's extra spending money. The cultural perception of glasses has improved, so glasses are considered to be fashion accessories now, and so there's not much pressure to get rid of them. But the main thing that causes patients to not want to have laser vision correction is probably fear. So there's a lot of myths out there that are inaccurate, that we have to make sure we educate ourselves on, and some of those things are things that need to be addressed, and then others are really blown out of proportion, so that we make sure that our patients, of course, are well informed, but that they understand that this is one of the safest procedures, one of the most widely performed procedures worldwide. So SMILE will grow the laser vision correction market. So just in 2015, 200,000 eyes have been treated, and in such a short time, 2.5 million have been treated. It's quickly gaining popularity as patients and doctors are realizing the advantages of SMILE. So the SMILE procedures, and this is a little bit of an old graph. This is in 2015 when there's just 200,000 performed. But as this line here shows that in clinics that can perform SMILE, this is the percentage of SMILE procedures that they're performing. So clinics that perform SMILE, the SMILE quickly overtakes the LASIK procedure because of what patients want and also the good results that are being found to happen. So in China, which started before us and has very high volume surgeries, of course, because there's lots of high myopes there, SMILE grew refractive procedures by more than 200% over a 5-year period. The conversion rate is here in green, and the blue is LASIK with femtoflaps, and the red is the SMILE. So same thing. Initially, it started out as just a small volume of the refractive procedures that they did, and it didn't really cannibalize the LASIK, but it did push up the volume in these clinics that were able to perform it. So what are the long-term refractive outcomes? This was a study done in Shanghai, and the average spherical equivalent was over -6. So these are quite high myopes, and this was over 4 years. So you can see here that it's very, very stable. So after the percent change, so these are the types of patients that have a little bit more regression, the people with higher prescriptions, and over 4 years, very, very minimal change. Also comparing, another comparison between SMILE and LASIK, you can see that there's excellent results with both, pretty much equivalent. So patients that have better than 20/20 vision, SMILE 90%, this is the same study, LASIK 63%, and then patients that have better than 20/16, actually 85% for SMILE and 44% for LASIK. So in summary, SMILE is a removal of lenticule of tissue from the midstroma, very similar to LASIK in terms of fast vision recovery and outcomes, if not better. Advantages that it's safer, there's less dry eye, more comfort, and fewer halos enhancement is very, very low, 1%. In our center, it's been even less than that, and it's just one laser procedure. You don't have to move from one laser to the other. Disadvantages, the cost is a bit more. There's definitely a learning curve compared to LASIK. And if you do want to do enhancements, there's no way to do SMILE twice at this point. Currently improved in the US for -1 to -10 diopters, and then also -3 diopters of SIL. So the vast majority of myopes are qualified for this procedure. So it's more than, SMILE is available in more than 700 clinics worldwide. There's more than 1,500 practicing surgeons, more than 70 countries, and again, 2.5 million performed. And at this point in the US, our clinic has performed the most SMILE surgeries, and we've had really wonderful results. So these are references in case anybody's curious. Does anybody have any questions for anything? I didn't notice any questions pop up. So if no questions, again, I want to thank everyone for spending their morning with us, and I hope that you learned something, especially about SMILE. Even my ophthalmology colleagues aren't familiar with SMILE, so really excited to be able to spread the word and let you know of one more opportunity you can give to your patients. Also wanted to note that for if you are interested in co-management, IQ Laser Vision does do co-managing, and Nick can give you some more information on that. The way that we do co-managing in our clinic is a little bit different from other clinics because we make sure that the patients are stable immediately post-op, so we definitely see them their first day afterwards in their first week, and then once they're happy, then we send them back to the OD to continue care. Also, I'm very hands-on with my patients, and I want to make sure. Oh, I got a question. Okay, what are the corneal thickness requirements for SMILE? So that's a good question. Similar to LASIK, so we are still weakening the tissue, and the vast majority of people have enough tissue for either one. So it depends on how high the correction is. So for higher corrections, we do still remove a larger amount of tissue, and we want to leave their residual stromal bed for with 250 microns. So, of course, these are things that we check for, and we make sure that we give whatever patients that come in the safest procedure for them. Any other questions? So another question here, do you find that visual results from PRK versus SMILE, that SMILE has better vision? I find that some patients with PRK have uneven healing and tend not to see as well. So we actually don't do that much PRK in our clinic. Patients who have PRK are typically they typically have higher prescriptions, and they're typically, or they have scarring. Those are usually the patients that have PRK, so they're kind of more difficult patients to begin with. So they might have a little bit more regression, and there's a little bit more variability because when the epithelium heals over, that's correct, they might have some uneven healing. However, PRK is still, in general, very, very accurate, so we just have to kind of take into account that it does take longer for them to heal and stabilize, and often that these are kind of more challenging patients to begin with. Any other questions at all? So I'll continue watching for those questions, and as I was saying, I find it very important to have a team-like approach to our patients, and even in learning from each other. You know, we come from different backgrounds, and I think optometrists and ophthalmologists have a lot to learn from each other. So I'm always available through my cell phone, so if you guys have any questions that you come in, you can always give me a call, give Nick a call. And if you have any questions, maybe something you read or a patient that you saw, or of course, definitely if there are any of our patients, we're very easy to get in contact with. And if there's anything that's questionable or anything that you've noticed, we're always available to address those things with you. And always, if there's any issues, we'll take those patients back and see what's going on. So the cost difference, the reason for the cost difference between LASIK and SMILE, it does vary from center to center, but we actually get charged more by Zeiss every time. So I'm sure people have, that was a question, what's the cost difference between LASIK and SMILE? And I would say for some centers there's no cost difference, and then it can vary from $0 to $1,000 depending on which center, but every center is a little bit different. And the reason for that cost difference is because I'm sure you guys have heard of click fees. So anytime we do a LASIK procedure or we do a SMILE procedure, there's a click fee. So we have to pay the manufacturer a certain amount of money, and they have decided to charge us more for SMILE as well. Great questions. As part of our OD network, the last thing that I wanted to leave with is that you can take advantage of our complimentary SMILE and LASIK procedure. So we have full faith in these procedures, and of course we want you guys to be on board and feel the same way that we feel. I would say 99% of our staff here has had the procedure done on ourselves. Obviously we see all the pros and cons of procedures versus LASIK, SMILE, versus glasses, contact lenses, and our eyes are obviously very important to us, and so are yours, and so are your patients. So to show how much faith we have in this, we do offer this complimentary SMILE LASIK procedure so that you can feel very comfortable in your results and then talking to your patients. Because at the end of the day, we want what's best for them. Any other questions? And if you think of any, like I said, always available by email or phone call as well, or text. Okay, thank you so much. I hope everybody has a wonderful rest of your week, and hope that you did gain something from the webinar, and hopefully at some point we'll get to meet in person.